think that when you look at the changes taking place in healthcare, and certainly don't look too far, the political environment we are in right now, there's a lot of questions being asked as to healthcare will be administered. That's different from how healthcare is delivered. If you're sick, you have to go to a hospital still. That's not going to change whether it's a Medicare for all or whether it's typical insurance program like we have today. If you're sick, you see a doctor. If you're real sick, you go into a hospital. Those are still, that's what I call delivery of care. If you need drugs, you go to a pharmacy and you get the drugs, and the drugs are renewed over a certain period of time. Those things still exist, and that won't change under any circumstance. What is changing is the way that healthcare is administered and paid, and how an individual has to take on that responsibility themselves, more so now than was in the past, because employers are not taking on that responsibility like they did in the past, because it's gotten too darn expensive to do so. And so what used to be a pretty much a bread and butter benefit is now one you have to study and evaluate and determine which one you want to pick from. It makes it for a much more complex environment than was the case years ago. RX use, drug use, is probably about 3 or 4 times greater now in terms of the cost to the total healthcare budget than it was just even 2 decades ago. And there's all different offerings, generic drugs, brand drugs, et cetera. And people are using voice at a rapid pace just to understand what's going on with the drugs, the brand drugs versus generic drugs. These are all questions people have. And trying to figure out your way around that process is no small task. So we think that having a tool like Wellbe or Hands-Free Health is going to help people figure that out, help them do it on their time in the comfort of their home, and being able to ask it questions about what are symptoms of certain diseases. What does this drug do versus that drug? How do I get, where do I find a medical facility? Reminding you when you take your drugs. These are all things that are very, very important. And also, when you get to an elderly age, I'm dealing that with a parent of mine right now, they depend upon a carekeeper. Our device will allow the carekeeper to be informed when the individual is taking their medication, or if they haven't taken their medication. If their blood pressure is really high, we'll call emergency services right away for them. So what we're trying to do is take a very confusing process that is healthcare and try to simplify it in a way to make it more user-friendly for the end user. And I think all the things going on right now on the political front, it's just going to serve to make it probably in some respects candidly more complicated, and will make a service like we're offering even more needed. Voice is key for that, and I think people have gotten more and more comfortable using voice. The stats prove that. The data proves that. The number of people using voice is growing every year at all segments, whether it be the millennials, obviously, are leading that charge, but also the baby boomers are now getting more and more engaged in identifying or using voice as a tool.